Hi, my name is Florence Ajayi-Barnes, your virtual family nurse practitioner, and welcome to the Flo-Medical Show, where you get information you can trust. On the show, we discuss health, being an educated consumer, and you being your own best advocate. Disclaimer, this is valuable information, but please consult your healthcare provider. Today's topic will be on health disparities in African Americans. Disparities are just differences. So, differences that we see amongst African Americans compared to Caucasians in health. Today, we're going to look at common diseases that we see higher in African Americans compared to Caucasians. We're also going to look at what are the reasons for such disparities and come up with some conclusions to help or decrease these disparities. Let's get started. Common diseases seen in African Americans. Heart disease. Heart disease is a range of diseases that affect the heart. Heart disease is the number one killer of all Americans. However, 20% of African Americans are more likely to have heart disease. Hypertension. Hypertension is high blood pressure. High blood pressure is the condition in which the force of blood against your artery walls are high. African Americans are 40% more likely to have hypertension. What's worse is 60% of African American women will have hypertension. Obesity. Obesity is the excess of body fat. African Americans have the highest rate of obesity. African American males account for 63% of obesity. African American women account for 77% of obesity. Diabetes. Diabetes is when the blood glucose or sugar in your blood is high. African Americans are 60% more likely to get diabetes. Stroke. Stroke is the damage of your brain due to blood interruption. African Americans are 50% more likely to have a stroke. African American men are 60% more likely to die of stroke. Cancer. Cancer is the uncontrolled growth of abnormal cells in one or more tissues or organs of the body. For example, breast cancer. African American women are 40% more likely to die from breast cancer. Chronic liver disease. Chronic liver disease is the gradual destruction of your liver tissue and cells over time. Chronic liver disease is among the leading cause of death in African Americans. Kidney disease. Chronic kidney disease is when you have a decrease in your kidney function that may lead to kidney failure. African Americans are 3 times more likely to develop kidney disease or kidney failure. Asthma. Asthma is when your airway is inflamed or swollen, causing it a difficulty for you to breathe. Asthma is more prevalent in young African American children and adults. African American children are 4 times more likely to be hospitalized with asthma. They are 10 times more likely to die from asthma. So these are the common diseases that we see in African Americans compared to Caucasians. What are some of the reasons why we're seeing the rise in these diseases in African Americans opposed to Caucasians. One is young African Americans are living with illnesses and diseases that we commonly see in older adults of other races. Heart disease, diabetes, hypertension, that is usually found in older people. But in the African American community, we're seeing younger people with these diseases. Access to healthy foods. The cost of living and the cost of groceries are elevating. Some supermarkets in the African American community are poor quality. Also, we have fast foods all around us. It's poor quality foods, the foods are cheaper, and they are supersized. It draws the African American family in because it's affordable. Social issues, being unemployed, living in poverty, not having a social network, alcoholism, drinking, smoking, all of these things put us as African Americans at high risk to getting certain diseases. Mental health issues. African Americans are 20% more likely to report that they have mental health issues. However, 60% of them will not seek any treatment or counseling for these mental health issues. If you have no mental health, you have no physical health. Poor quality health care. In the African American community, sometimes it's hard to find a good provider. You may have to leave your community to get a good provider. If you have no transportation or it's farther away from where you live, you may decide not to do follow-up care. Also, language barriers. Many African Americans that live in the United States have migrated from other countries and they don't speak English. And if they don't speak English, they tend not to seek care because they can't understand what's going on. So these are some of the disparities, some of the reasons as to why the disparities are high in African Americans versus Caucasians in these health issues. So what are some of the solutions? We can sound the alarm, bring on public awareness. Now that you know, you can discuss this with your family members, your friends, your colleagues. Also, sound the alarm and call your local leaders. Let them know that the disparities in your community and in healthcare is not acceptable. They cannot guarantee your vote in next election if you don't see any change in your community. As a healthcare provider, I can serve in underserved communities. Also, as a healthcare provider, I can increase and strengthen health literacy amongst African Americans. Discuss with them about follow-up care, their bodies, the importance of eating healthy, importance of physical activity, and meet them where they are, whether they are college graduates or high school dropouts. Give them the information on the level they're at so they can make informed decisions about themselves. Also, in medical schools and schools where healthcare practitioners come from, health disparities should be discussed. So these are the next leaders and they have to know what they will be facing. There you have it. You have been informed. Be part of the process. Be part of educating others about these disparities. Please like, subscribe, and share this information with anyone you feel can benefit from it. My name is Florence Ajayi-Barnes, your virtual family nurse practitioner, and thank you for joining us at the Flo-Medical Show. See you next time.